good afternoon. Thank you everyone for joining us today for session 3 in our webinar series, Putting It All Together, How to Talk to Families and Patients in a Supportive Environment. And I'm so glad that we're able to feature Dr. Valerie O'Hara as our speaker, and I will turn it over to her now.
Awesome. Thanks, Carrie. And thank you all for taking this time to join us in our third in our series here. So we'll get started with thinking about a framework of how we talk with patients about any diagnosis. So the 5 A's is a model for behavioral intervention strategies, and it's been adapted for obesity management. So it starts off with ask. We're going to ask for permission to discuss growth trajectory or obesity, or I tend not to use the word weight because I think that's a vital sign. And then once we've gone through that stage, we can assess. We take our blood pressure, we're going to stage that 1, 2, or 3. And that then helps us guide our future discussions around this diagnosis with our families. And then once we've been able to gather that information, I call it my fact-finding mission, we can use all of that to then advise, right? Offer the opportunity to explain benefits of weight management or obesity care, and explain these for short and long-term strategies, because we know, as we've talked over our sessions, that obesity is a chronic disease. And then we can agree on realistic goals and expectations, things that they can work on, come up with a shared decision-making plan, right? Again, awareness of what's out there, sharing the data when families and patients are ready to hear that. And then once we've come up with a plan, we need to assist with education, tools, resources that we might share, and we're going to arrange that follow-up. The Red Center also shares some strategies that can help facilitate a supportive communication, right? Looking at active and reflective listening. And the next few slides, we'll kind of break these down a little bit as well. Using sensitive and respectful language. Acknowledging patients' prior experience. I remember the adolescent that I talked about in our first webinar. He shared in his podcast with medical students to acknowledge prior experiences and treatment endeavors that they've engaged in. Oftentimes he shared that the new healthcare provider didn't acknowledge what he'd already been doing that were already very healthy habits. And then focusing on those health behaviors and not weight, treating this like a disease, and then engaging in collaborative goal setting because it's a shared decision-making process. The Red Center also shares this idea of using the ORS approach, which is using open-ended questions. Can you tell me more about that? How do you feel about this diagnosis, your healthcare, your goals, right? How does that make you feel? Affirmative statements. I can understand why you feel this way. Thank you for your willingness to share and discuss this with me. I use that last one a lot. Reflective listening. It sounds like you feel XYZ, so bringing that back. And then with reflective summaries to really come back. So what I'm hearing you say is X, Y, Z, making sure we're understanding each other. So that active listening and reflective listening can help us alleviate patients' anxiety and fear. We know it can promote patient engagement and building that trust, and then making sure they feel validated and heard and understood, right? And this also offers the opportunity for clarifying expectations or misconceptions, making sure we're hearing each other because we're working in that shared decision-making process. In terms of respectful terminology about weight, the Red Center has shared this data and was published in 2021 and 2020. And overall, the words about weight, it can be very sensitive. But overall, in the publications, the preferred terminology that stands out is weight, high body weight, or unhealthy weight. Again, this is very individualized. So starting with the first of the 5 A's, which is asking permission, can we talk about your growth today or your health around weight? And if they say yes, then you can say, you know what? Obesity is a diagnosis. It's in the EMR, but I want to know what words you feel most comfortable when we're talking about this diagnosis. And then you go ahead and use that term. If they say, no, I'm not comfortable, acknowledge that, validate that, say it's okay. And so putting it out there that I'm here for you when you're feeling ready. So in this slide, it's really the initial outreach in a clinical application. This was from my prior nurse clinical coordinator. So when we were getting patients referred to us, the first thing she would do is reach out to the parent, answer their questions, and really meeting the patient and parent in that moment when she would call was really, really informative, helpful, and then patients know what they're walking into and feel ready to come. Validating what has their prior experience been with healthcare providers, or even with their parents, maybe if you're talking to the patient, really assessing how they are describing obesity, how to review prior treatments that they've already tried. So taking the time to listen, as that is focused, voluntary, and intentional. So we want to validate that we're hearing them and we're listening to them. And when we do that, we can provide empathy. So the next steps, once we've had that, right, we're building on that rapport and always keeping the why first. And this can increase our parent receptiveness and readiness to engage in those conversations. And then addressing myths and also being aware of cultural beliefs and letting the patient and parents share. And being aware that we're listening for signs of prior bias, but we're also reading that body language from the patient. And we can do that even during a Zoom visit for sure. And we're making sure that, again, to quote that very wise teenager at the time, if you're going to talk about this, be accurate, make sure your information comes from the heart and actually reflects the complexity of the disease of obesity. So when we do that, then we can start to share a comprehensive expert approach to medical care for this diagnosis. And this highlights you are treating obesity like any other disease. So patients' words and their experiences is certainly what we want to think about and want to use. And so in this paper that was published in 2017 in the AP statements, again, their findings underscore the diversity of youth preferences, right, and the need for individualized approach. Terms that patients preferred were weight, normal weight, healthy weight, and some ethnicities preferred curvy and thick. So the best way to know is to ask. More recently, Dr. Poole was presenting, and she was sharing additional data that came out and that they published in 2023 that negative comments from parents showed worse adolescent health and well-being in terms of greater depressive symptoms, higher internalized weight bias, more unhealthy weight control behaviors, and poorer body image. Versus positive comments from parents showed improved adolescent outcomes. And these findings were consistent across all of the adolescent sociodemographic characteristics, and regardless of whether this was coming from their mom or their dad. Additionally, in her presentation from that same paper, parents want guidance on how to communicate about this diagnosis. And so they're coming to us as their healthcare providers to provide that guidance. And most parents want information and resources for strategies that can help. So improving their child's body image and self-esteem is vitally important. Supporting their child in making healthy choices for long-term health and focusing on health rather than weight. And helping their child feel supported with their size, and particularly for children who are being bullied and teased, and how can we help them? We know that, unfortunately, in healthcare, have certainly been found to attribute the causes of obesity to controllable factors such as lack of self-control, laziness, and lifestyle choices or overeating, and that parents are blamed for their child's weight. Many times parents are viewed as personally responsible as a failure for their child's weight, even when their parenting practices that they were describing were aligned very well with the AP guidelines. So what do we do in our environment, and how do we make this better for us and our patients? So key points: the environment that the patient encounters improves care. We have a big sign that says, "Welcome, we're glad you're here." And they need to feel that from the moment they walk in the front door of your office. We want to share that we're listening to them. And when we do that, we can build our trust over the next few visits, right? And ultimately, the goal of the first encounter, or if you're the primary care doctor, first conversation that you might be having about the diagnosis of obesity will lead to the second. And in 2017, the expert panel found that the decisive factor in obesity care was not what sort of diet the patient went on, but how much attention and support they received while they were engaging in whatever therapy that you all devised together as a family and clinician. So when we're thinking about all of this, what does this teach us? It's really asking us to think about the team approach. And then we can share those treatment options with the same level of medical data as we do with any other diagnosis. And when we do that, we can ensure ongoing monitoring for response. And remembering to leverage your expertise as the primary care provider or any of the pediatric clinicians who are working with your families, right? You have that mastery, you have those skills of having really sensitive conversations on a host of medical topics, and coming in there and being compassionate and taking the time to listen and validate. It goes a long way of building that trust for our patients. And I'd like to close with an important quote from a teenage patient of ours, and these are his words. "If you give advice, make sure it's accurate, it comes from the heart, and reflects the complexity of the disease of obesity." Thank you so much, and I look forward to further conversations and discussions in the future.